Hello, welcome back to my channel. If you're new to my channel, my name is Pat Ogban. I did a video on Get to Know Me. Make sure to watch out that video. For all my returning subscribers, I greatly appreciate you coming back. Thank you so much for helping to move our community forward. Today is all about diabetes. Diabetes is a condition in which our body is unable to regulate or control the blood sugar levels. So it ends up being too high or being too low. Hypo and hyperglycemia. Hyper is when it's high, and hypo is when it's too low. Different types of diabetes. We have pre-diabetes. Pre-diabetes is when you have this condition that your blood sugar level is high, but not high enough to progress to type 2 diabetes or to be diagnosed with type 2 diabetes. Pre-diabetes can lead to type 2 or can progress to type 2 diabetes if left untreated. Can you reverse pre-diabetes? Yes. Can pre-diabetes, if treated, delay progression to type 2 diabetes? Yes. So it's really important for us to know our status. We have gestational diabetes. This usually occurs during pregnancy, and sometimes it will go after the baby is born. We also have type 1 diabetes. Type 1 diabetes, unfortunately, is a condition whereby our pancreas is unable to produce insulin. And so our blood sugar level is left dangerously high. And with somebody with type 1 diabetes requires insulin to control the blood sugar level. Sometimes people with type 1 diabetes also requires additional medication, including healthy eating and exercise to manage the condition. Unfortunately, there's nothing you could do at this time to prevent type 1 diabetes. Type 2 diabetes is more common type. It develops through a combination factor: lifestyle factor, family history, genetic, obesity, stress, sleep problems, and environmental factors. So, who's at risk of developing type 2 diabetes? Wait, if you're obese, you're at risk. If you're physically inactive, yes, you're at risk. Then you add more weight, and then you are higher risk. Family history. Unfortunately, if you have a sibling, parents who have diabetes, you are at risk of developing diabetes. Race and ethnicity also play a role. Some ethnicity and race have higher risk of developing diabetes, including Black people, Asian, Native America, Pacific. They are more likely to develop type 2 diabetes. Yes, if you have high density lipoprotein, which is the good cholesterol, in low levels, then you are at risk. Pre-diabetes, if left untreated, you are at risk. As you grow older, yes, you are at risk of developing diabetes. Also, if you had gestational diabetes, there's likelihood that you might develop type 2 diabetes. Yes. The other thing that puts you at risk is polycystic ovary syndrome. It's a condition characterized by irregular menstrual period, excessive hair growth, and obesity. It does increase your risk of developing type 2 diabetes. But the good news is that you could do something to reduce your chances of getting pre-diabetes. You could also do something to delay the progression of pre-diabetes to type 2 diabetes. Yes, pre-diabetes can be reversed. Type 2 diabetes can also be reversed or can go into remission, as some may call it. Absolutely. But it's up to you to do something about it. However, if you do something, you would see good results. Complications of diabetes can lead to serious damage if they go unchecked and untreated. So, if you've been diagnosed with prediabetes, diabetes, you have to take action, and that action should be now. I'll see you on my next video so we can talk about the complications of diabetes.